on other children around. A child, can I actually say a child? This began from childhood, but the parents did not pay sufficient attention, maybe for whatever reason, and but went to one university, and somehow after 4 years brought nothing out, and then was now brought to another university and told the parents eventually after 5 years that he was graduating. And the parents came, no, he had been telling them he was graduating, and finally the time of graduation came and he gave the parents a wrong date. So if you have ever read Revelation 23 in the Bible, you know what I'm talking about. Okay. The graduation was one day, and he said it was the following day. But somehow, so they went to church, they met in church, and they saw their friend, oh, what are you still doing here? You are supposed to be at your child's graduation. No, it's tomorrow. What graduation is tomorrow? They are there now. No, he said it's tomorrow. And they called him. So, what about this? Oh yeah, I forgot. Yeah, it's a little mix-up. And they said, we're coming right. No, you don't need to come. It's not really important. No, we're coming right away. And before they got there, he jumped from the top floor. And he didn't make it. So they got there to meet with disaster. What I just wanted to point out is it's not just a question about providing the money. It's not just about providing whatever the needs. We need to actually, I love what Mom said here. She said, I will look. Yeah, I must have access. You need to actually define the rules of engagement in your home. We're not saying deprive them of privacy. No. You have to teach them to respect others' privacy by respecting their privacy. You knock on the door, you wait to be, but if there's not just hanging there forever, if you knock once, twice, and something's called, you peep, and then you go in. But somehow, this is not a blame casting session. We are brainstorming, not blame sharing, okay? So, but not being careful. I pay the fees. I know in the West today, the privacy laws don't allow you to see the performance of your child once your child is above 18. That child's an adult, so they expect you to have a personal engagement where the child can report to you. But that law is actually the other side of sanity. It is a post-sane legislation. If I pay, I know. I receive. I cannot pay and you give the result to somebody else. So that is where it's not everything that we get from the West that we copy, because a lot of it, they have lost control in so many different areas. And that's one of the things that we, in Africa, we cannot be losing out on every side. If we have lost out on technology, we should not lose out on culture. We should not lose out on morals, on our discipline. Because then eventually we can sell what we have to them in exchange for what they have. That's something area in which we're strong. These parents have never really insisted on knowing their child's performance. And whatever the child told them was what they accepted as gospel truth. And suddenly now, the child is faced with the dilemma of being found out and confronted, and somehow the devil played on that, and he was overwhelmed. He did something that was stupid. He jumped. Okay, it was. They didn't think it. That's actually that was an impulsive reaction. But the point is this: the damage was not limited to that child. That child had younger ones at home, and the question is now the younger ones are withdrawing. They are acting. They are showing all the different signs that Dr. Ajirotutu talked about, and now there's panic, and the parents don't know what to do. One is gone, the others are, and then the parents are now freaking out. Let us invest emotionally, not just financially, in our children. You know, there are some instances. On the 25th of March, I think 2015, the German Wings, do you remember that? The German Wings, a 27-year-old pilot, is a co-pilot, he was a co-pilot. He locked the captain. The captain went to the toilet, and before he came back, he locked the door to the cockpit, and then he went and crashed the plane into the Alps, into the mountain. 150 souls died. So it was a murder suicide. When we're talking about previous law, what killed 150 people and ruined lives and futures and fortunes? It was because of these privacy laws. That pilot had been diagnosed with depression. He had been caught with suicidal ideation. But because the laws did not allow the hospital to share that with his employers, he did not tell them at work. In fact, the employers had already given him a stop work. The hospital, the doctors had given him a stop work order, which he did not share with. And that was the point at which now they had to change the laws in Germany, in Switzerland, just because, but that's a reaction. It was too late for 150 families. So there are situations where your decision may affect you alone, but those are very restricted. Even if somebody that you did not know jumped on the Third Mainland Bridge, that still it has some traumatic effect on those that read or those that are around, not to talk about the families. But now imagine that kind of a murder, suicide, something. We owe a responsibility, a social responsibility, moral responsibility, and I dare almost say personal responsibilities to others around us to make sure that we are watchful and that we have the courage. Competence is one thing. You can have the competence, that's basic. Character is another thing. But where most Nigerians lack action is courage. We do not have the courage of action. We would rather speak behind. We would rather choo around. We would not have the courage to call something to question. If I see a conduct that I know may bring danger. In America, guys who are going to depression, little children bring guns to the classroom. And that spells death for so many. But unfortunately, very unfortunately, that is creeping in on our society. And some parents say, it's not your business what my child brings to school. It's not your business what my child does. My child is my business. No, I'm sorry. Your child is my business if your child is in my environment, in my world. Thank you.
Thank you very much, sir. Before I take one or two questions from the audience, I see many hands already. I'd like to ask if we have any community-based program presently that we presently run in the country that helps to mitigate, issues relating to suicide. Do we have any? And that has been successful so far?
Yes. So we'll give you the number before we leave, so that there's this SUPINE, we call it Suicide Prevention Initiative Nigeria. And we have connections all over the country, like the 36 states, even Abuja. And there's a toll-free line, so that if anybody needs to talk, all you have to do is call. And they connect, they put it on the platform. Even if it's in Akure, it's in Taraba, we just call. There's a case from Taraba. Who is in Taraba? Go to that person's house. And we also monitor the social media. So once you see any write-up, because usually that's one of the first symptoms that something is going on, they write it on their wall. So once we see that, they begin to look for the number, and we get connected, and they go and get the individual, particularly about suicide, depression, anything that has to do with depression and suicide. So the lines are toll-free, so you can call at any time and you'll be attended to. Okay, anywhere in Nigeria. So it's not just in Lagos.
Thank you very much, ma'am. I know that you had mentioned this earlier, but then there are new joiners that joined us after your first presentation. So I'd like to ask again, just so that we're more affirmative about it. Can depression be conquered?
Definitely. It's a treatable illness. It is a medical illness. So don't let's say, okay, I won't go there. It is a medical illness. It can be treated. Easily treated. So don't keep, people just stay in there and they are suffering. Because depression is quite, it can be terrible. Because they can't think, they can't remember anything, they can't function. It's like some people will say, it's like you put them in a well and they can't get out. It's like there's a load on their head, on the back of their neck. They're just suffering unnecessarily when it can be treated. So it can be treated. And at the end of the day, we also look for good social support so that it will not reoccur. In as much as we have different types, mild, moderate, severe, the causes too, we also have the types, endogenous happening within and exogenous. If it is endogenous, that means chemicals in the brain, for whatever reason, they are low. So the person will come down with depression just like that, and you are wondering. And exogenous means external causes. Problem, domestic violence, the child is not happy, the child is feeling like that child that killed himself. So external causes. So we deal with both. If you can have a good support, if it's due to external causes, then most likely that individual might not have a reoccurrence. But if it is endogenous, that's from the brain, it could reoccur. But if you follow your doctor's instruction, you understand the nature of the illness, and you guard yourself. Make sure you sleep at night. Make sure you eat well. Make sure you don't keep things to yourself. When things happen, I cannot solve this problem. Who can help me? That is the way to go. You need money. I might not be able to give you 1 million that you need. But if I give you 5,000, he gives you 10. He gives 100. He gives, before you know it, that 1 million will be. But if you keep quiet, we are going to pray to God, and God will direct you to those that you are going to meet. So depression is treatable. Please, don't let us suffer in silence.
Thank you very much, ma'am. All right, so we're going to take questions now, but I would like to give us numbers so that we don't break questions from question. All right. Number 1, number 2, number 3, 4, 5, 6, 7, sir. 8. All right. Okay, let's start from number 1. 1 minute, please. 1 minute per question, please. Thank you.
Thank you very much. My name is Doris Gbemiloye from Genotype Foundation. My question is very different from what you've been saying. You've been talking about generality. I want you to see the area of people living with sickle cell. Even doctors put them into depression by their words. Nurses put them into depression by their words. Family members also put them into depression. Please, I just want us to just talk a little about it. Like a doctor telling, are you not used to it? Are you not used to the pain? She knows what he or she is going through, and a doctor is telling her or him, please, let's look at area of depression with a person living with sickle cell, because when you're talking about suicide, I've seen so many of them. I've been with many of them that at the point of committing suicide because of that stigmatization and the depression both parents, society, school, and others are putting them. Thank you very much.
All right, so thank you very much for your question and for raising that very pertinent concern. If you did notice, when I was speaking on one of my slides, I said children in especially difficult circumstances. And so there's so many children that we don't even, children with asthma, children with chronic pain, children with polio, children with deformities, physical deformities, mental deformities, sickle cell, of course. And by mentioning all of this, it in no way invalidates what they're feeling. We see them, we hear them. When you were saying doctors and nurses, not the ones here. Because we are aware, we're informed, and we're also trained. And so part of what we're also doing, I must be honest with you, is to train our other colleagues so that they know how to do things like, 1, break bad news. Number 2, support people who go through difficult times and difficult moments. So again, we may not be able to take the responsibility of so many others, but we're happy to, share from our wealth of experience to teach them about things about emotional intelligence and how to be sensitive to the needs of the individual who sits in front of you. Thank you.
Thank you very much. Number 2.
Thank you very much for the wonderful impact that we've been taking. I just want us to look into this wonderful vacuum. When mommy was talking the other time, she was talking of a parents taking care of the children and supervising them, monitoring them. But can we put into consideration the orphans, whom their parent is no more? They say when woman support or material of any kind is being removed, God hand become operative. But who are those that will be able to dictate, or who are those they could be able to report themselves to? Because without introduction and engagement, there cannot be marriage. And if the parents are meant to do the introduction and engagement for them before they get married to themselves, and their parents are no more there, what advice or counseling can we give to such a group?
Okay, thank you very much. I want to believe that the orphans that he's talking about will be in orphanages. So they usually have maybe group mother, father, somebody overlooking them. And that is why we are saying, I think this is very important, this talk this morning, because it's advocacy. And like she said, for the sickle cell people, you should always have mental health professional in the group that are treating them. That's the only way people can know. So go to the homes, or we invite those mothers and fathers in these orphanages, so that they listen to talks like this. They must be taught too how to address these issues, how to look out for. You gave one about that child that was picked, and they were talking to her. I'm sure they were telling her, you wanted money. That was why she was going to take you to Italy. I can just imagine the comments that as I sat there, the comments are just going through my brain. So we need to go way down. NGOs like this, not just, we need to go to the, to the grassroots, and so that the professionals can teach other people how to manage, how we converse our speech and all that to the people we are taking care of. Then sickle cell people, we must have mental health professionals in their management team, so that at least that's consultation liaison. It is important, because that's the only way that these things, we can curb it, and people will get better. And our other colleagues, do you know that they even stigmatize us? Because once you hear psychiatrists, they'll go this way. Is that no? So we are stigmatized as mental health professionals. So I can just imagine what they are doing to others. But the Association of Psychiatrists in Nigeria, we are trying to work at that, to look at the curriculum right from medical school, so that psychiatry is incorporated. Because right now, we only do like 4 weeks of psychiatry in all the medical schools in Nigeria. Maybe it was your last year in school, final year, you just do 1 month of psychiatry. So what are you going to know? By the time I was going into psychiatry, 6 years after I graduated, I did not know anything about psychiatry. I went for my interview, the CMD looked at me and said, you don't know anything. Don't worry, because we don't have any psychiatrists, we will take you, then we will teach you. So you can imagine. So it's not their fault they don't know, but we are trying to change that right from the curriculum in medical school, so that psychiatry is started early, so that by the time they graduate and they don't go into psychiatry, they know how to deal with all of this. Thank you.
Good afternoon, everybody. My name is Benjamin Onyesom. I wrote down my question so that I will be brief. So I have a friend, I would refer to her as D. She has been diagnosed with depression, however, with no sign of suicide or ideation or the attempt. So this was years back. D was okay for a while because she was getting professional help, but suddenly the case began to worsen and she started to self-harm. At first, she reached out to me, right, because I'm very, very loud about mental health, so she reached out to me to speak to me about everything. So I referred her to someone, but still, even after the referral, she was not still forthcoming, she was not still willing or committed to self-care. But it got to a point where she started to isolate herself, self-isolation, which is a normal symptom or sign of depression. So as a friend and as a psychologist, what is there to do so as not to lose hope?
Well, from the short history you read out to us, the most important thing which should have been done from onset is proper assessment. Assessment is the key, because you could see that once assessment is done, you're able to draw out your plan, identifying the causal factor for this individual, because this has been an ongoing condition. And you could hear what Dr. Akiola said. It is treatable. When you are able to do a proper assessment, you're able to identify the problem. You itemize them, look at all factors, social factor, psychological factor, even biological factor, because probably that person will benefit from medications. Because the treatment is in 2 ways, chemotherapy and psychotherapy, or counseling. Some people might never get to use medications. It depends on the level. I talked about mild, moderate, severe. Once it moves between mild, moderate, and moves to severe, and it starts affecting that person's functionality, medications might be introduced. That person could have benefited from some medications, from depressive medications. As he or she benefited, we can't say, So that could have helped propped him or her up, then psychotherapy or counseling will work side by side. So a proper assessment needs to be done to be able to help this person. Because I could just say that it's an on and off thing, And probably once the problem has not been nipped, there will be relapse. Thank you.
I'm thinking, in addition, I'm thinking that maybe she was not properly counseled about the nature of the illness. Because if an individual, if you do not understand what you have, and they do not accept that they are ill, that is the usual behavior. They'll just be moving around. When the symptoms come, they'll seek for help. When the symptoms go down, they'll go away again. But you have to let them know, if you are not taking care of yourself properly, this is a relapsing illness. It will keep reoccurring. But if you can get a grip of it, understand it. This is yours, but you can deal with it, and you can go on with life without it reoccurring. So I think she first of all needs that counseling to understand what the problem is. Then you take her back. If you have to forcefully take her back to the hospital for a proper assessment, then the management plan. That is when she will improve.
I think one of the things that the brother here maybe have suffered from a little bit is the dilemma between betrayal of trust and seeking help. You don't want to let this person think you have betrayed their trust by going out to look for help, and yet you have not been able to persuade them that they need help. That is a true dilemma. But at a point in time, if it's going beyond what you think is safe, you need to override one with the other. I don't know, but I would override one if I think it's getting to the point where the safety of this person cannot be guaranteed, and they have not yet arrived at the point where they could seek for help for themselves.
Thank you. I just want to add just one quote to all the beautiful things that they've said. And it's about self-acceptance. Accepting a mental illness can be one of the most difficult things to do for anyone. But there's this quote that I like, that there's
my name is Nkechi Modi, and I just want us to touch on a little on postpartum depression, because I was indifferent to it until my younger sister had her baby. I mean, I'd had 4 children already. I never experienced it, and I just saw it as an Oyibo thing. They are not strong. I mean, what's the big deal? You gave birth to a child, snap out of it. But I saw her one night, within the first 1 week of the child's birth, being very upset with the child and trying to even beat him because he wasn't sleeping at night. And saying, I've done everything. I just grabbed the boy from her and said, you go and sleep, and I'll take it from here. And that became the pattern. So I just want to, because many people may have similar things and may end up badly. Thank you.
Thank you. So thank you for that question. A few years ago, there was a story of a woman in Ibadan. I don't know how many of us heard it, but it was on the news. She gave birth to a set of twins. And on the day of the naming ceremony, she took the children, went to a bridge in Ibadan, and dropped them into the water. Postpartum depression is real. You know, interestingly, like she just rightly said, many times we don't appreciate these things until they happen to us or until they happen to people around us. Postpartum happens following the delivery of a child. And like you rightly said, she had had 4 children and everything had gone on well. Pregnancy is different, even in the same woman, at different pregnancies. The stressors, the pressures, the challenges, the fact that you are not as young as you once were, you may not even have the emotional, psychological, financial support to cope with, you know, that pregnancy or the childbirth. How much support do women get in pregnancy? Do they work? Is the gender of the child what they even want? You know, there's some women that have had 4 children and everybody's just waiting like, well, if you don't have a male child, your husband is going to. So there's a lot of pressure. And of course, you know, the environment may also set people up for a depressive illness. So postpartum depression is real. It happens even in women who have had previously successful pregnancies. And it's important that women get appropriate help and support when they go through life-changing experiences like pregnancy and even childbirth. I mean, see the pain of childbirth, having to go through the pain, bring forth a child. Some women and families sometimes may even be confronted with the fact that the child has a disability. So there's a lot to cope with, but the most important thing is that we must hold our women. Don't call them lazy. Don't dismiss them and think that everyone else has done it before you. Why can't you do it? When we see that people struggle, there's this Nigerian movie for Mariah. It also shed light on how women struggle during, their postpartum period. So definitely, people need help and support, and we should not be dismissive of it. Beyond emotional support, they may also need professional support and may also need to take medication as well. Thank you.
Number 5.
Yes, please. Good afternoon, everybody. Good afternoon, colleagues. It is often said that people who study counseling, mere counseling, are not able to diagnose depression. But in our midst today, we have a lot of counselors. My name is Dr. Kenka. We have a lot of counselors in our school counselors here. So when is it that the school counselor should identify that that child, the teenage child, or has to be referred? And we don't have public places. I'm in the school system. I'm a district counselor. We don't have public places where these children can easily be sent to meet with clinical psychologists. So, what will the results be? Because the question now is, when do you want our school counselors to refer these students to? Maybe later she will give us the numbers that we will use. Thank you.
Okay, we have child and adolescent units, that's 0 to 18. They pay, but their pay is subsidized, okay? Because, you are going to come from the state, and we are federal. So there's always that issue. But the most important thing is, like I said earlier on, once there's a change in that student, a student that was getting 98%, and now the grades are going down, or the student comes to class, is now sleepy, or the school uniform is now dirty, is torn, and that wasn't the case. If the child are coming like that throughout, that's a different thing. So a change, once the teacher notices, we do not expect you to make a diagnosis. What we want is for you to make early referral to us. Then we'll be able to assess the child and get back to you. So the child and adolescent unit, psychiatry, is in Oshodi. We have an annex in Oshodi. So, and they do a lot. They do school programs and all that. So maybe you can come in and you meet the head of that unit so that you can have an agreement. Either they come to your school, if you have a school clinic, they can send their nurses to you, or you just bring them to Oshodi once you notice something. Okay? So I think maybe we will exchange phone numbers, so I will tell the head of department and you can communicate from there. But there are places that you can take them to. All right. Thank you.
Okay, number 6. My question, I'd saved it from when, number 7.
Okay, thank you. So I have 2 questions, but I'll kind of just put into one. You were talking about encouraging children and, showing love and all of that. And I want to just find out, is there a point where we need to also raise resilient children, where they're not overly dependent on the affirmation and acknowledgement of other people or their parents to prove to themselves that they've done well? Because what I've also seen sometimes is there's some young adults that have grown up and have also, because my father didn't tell me well done or was not around when I didn't do one football well and all that, then it all constantly needs the affirmation of their father or mother to tell them well done and be well, you've done well, I'm proud of you. Because for my own son, for instance, I always instantly tell him that he does not need me to tell him that he's done well in certain things, or he doesn't need to be constantly told that how does he feel about this achievement he's made, how does it make you feel, and all of that. Not just so. Even if you want to overachieve, for instance, he always wants to be the first in everything, and so when he's not first and he's second, is a big problem. So, but is really how to kind of redirect. He's still young, so I know there's still room for improvement. Like, how do you then tell him that, oh, look, even if you're first, I'm not telling you to be an underachiever, but even if you're second or third, all you need to do is, try harder next term or next year or next and be better. And then when you now win at this goal or, score this goal, I don't need to be there to tell you, oh, you've done well. How do you feel by yourself? I just want to know where there's how to balance not being tough love, because you also want to build a resilient child, and also, resilient and not overly dependent on my praise or parental praise. That's my first question. My second question is, I have this was sent to me by a friend, but so I'm not going to really mention the name. We talk about kids that are bullied. In his own case, his son is the bully. So how can that, because he's now the one causing problems for other children. So how do you now treat the bully in this case? When you now realize that you are being called to the school, you're not being called to school that your child is the bully. You're now being called to school that, the other way around. What would you do?
Okay, Dr. Moju will answer, but before she does, of course, that child is going to need treatment himself. Then I think you are doing okay with your son. You're not doing so badly to get that balance, The resilience means the ability to bounce back from adverse events, because things will happen. For example, if he fail big time, first to third is not too much failure. You just tell me that what happened. Maybe you didn't sleep well, so you forgot when you got into the exam. So that's why, so you need to sleep, You tell him about that. But if it's big failure, you must be ready to teach. And if sometimes these children might not even listen to us, because it's like, is it not mommy? So that's why sometimes you need to bring an external person in. So don't say, okay, you don't want to hear psychiatry, that's okay. Get a counselor, get a psychologist, an outsider to come in and explain to that child that, things happen, but the important thing is that, you're still alive and well and you can move on, So that is important. We might not be able to help our children all the time because we are the parents. So, but when an outsider comes in, then they do a better job. So over to Dr. Abiri.
Okay, maybe I just want to chip in on the position. And there's a very major one for parents. Oh, my child is 10th position or 18th position out of 22. And parents flip. I tell them, go and look at the grade and the percentage of that child. Go and look at the percentage of that child. If a child has 68% and is 18th position out of 22, that is a B. That is a B. That child could be in a very, very top class, strong class. For a B, all through, that's almost 2-1. So it's the expectations about parents. And this damages the children so much. I've seen it over years. And they have their strengths and weaknesses. Those are the things we need to first identify. Their strengths and weaknesses. Positions at times, you see, where you're going to compare the older generation and this new generation. They only do, I say, you have only 4 things to do. read, eat, sleep, and pass. That's what I tell. That's what they are doing because everything is being provided for them. At least basically average families, you know. And we talk about building them for independence, which a lot of parents are not doing. And I think Dr. Boju mentioned that earlier on that things that you are supposed to let them do, you feel, oh, you cannot do it. You will go and do it for them. You send the child from here now to the next end of the road to buy something. After 3 minutes, you start getting worked up. Then you leave yourself, you find out you've left your home going there to check the child. And I go, but mommy, I can go now, let me do this now. And that is one of the things that we've seen a lot of parents do. Because like you have to bring them into it from childhood. Like Dr. Akinola was saying, you expose them gradually. How do a child learn how to cook? You take them to the kitchen, they are there with you. You know, they bring this, bring that, and learning is by observation. And after taking them through those learning process, you start exposing them, you are doing it, then you stay back. That child will pick all those things. Presently now we have so many married women who cannot cook. Dr. Boju said, and men. I won't say men because there are some traditional roles. You know, men learn how to cook when they go abroad. That one is compulsory. I've observed that. Thank you.
Thank you. Right. So again, to your question, when my daughter was 6 years old, one day she came back from school, and she said, "Mom," I said, "Yes." She said, "Do you know who the smartest person in my class is?" I said, "No." She called the child's name. She said, "Do you know who the second smartest person in my class is?" I said, "No." She called another child's name. She said, "Do you know who the third smartest class in my..." I said, "Tell me." She called another child's name. I said, "Where are you?" You know what she said? She said, "I am nowhere." I had goosebumps all over my... I felt bad. But I asked, "Why do you think you are nowhere?" And so, the star chart in class, you know those star charts where somebody gets something, they put it. That was my daughter's definition at that age of what success was. And so I said, "Look at me." I said, "Say after me, I am smart." She said, "I am smart." Say after me, "I am intelligent." She said, "I'm intelligent." Say after me, "I am phenomenal." She said, "I am phenomenal." I said, "Do you know what else you can do that your other mates can't do?" Who came first in the spelling bee? She said, "I did." Who came first in swimming? She said, "I did." I said, "So you see, while academics are very important, I'm more particular about a well-rounded child." I said, "So and from today, the next time anybody asks you who the best child in your class is, what will you tell them?" She said, "I said, no, it is you." It's a constancy. And so regardless of where she goes, she would always remember, especially because that age was when she was, you know, building her self-esteem. Extremely important. The second thing I want us to know as parents is we always talk about the 4 Qs. IQ, which, you know, everybody's always, child must be the first, my child must be the first. Meanwhile, when you were in school, you were not the first. I was not the first. I wasn't the smartest child in school. There's the IQ, intelligence quotient. There's the SQ, social quotient. There are a lot of children who are so intelligent, they're first-class graduates, they can't have conversations. There's the EQ, emotional quotient. And there's the adversity quotient. Beyond one, our children must have all 4. Very, very important. I think that the last thing I want to say is that parents must model the behavior you want to see in your children. Teach your children with the simplest things. You see, there are many things that we don't pay attention to. One day I bought a Ludo board, and I told my children, "Let's play." And myself and my daughter had brought out 2 men, and my son had not brought out any. And my son started crying. And I said, "Why are you crying?" He said, "Because I'm losing." I said, "But no, do you know you can still win this game?" He said, "No, he doesn't think so." I said, "Watch what will happen." At the end of the day, he won. And so I said to him, because you're a child, your frustration tolerance is still low. But you see, with things like games, Ludo, chess, Scrabble, having him do things like opening a bottle, I noticed that because his hands are not so strong, he struggles with, and I will say to him, What you're dealing with is a problem. You're a scientist, right? Now, look for ways to solve that problem. And so we must encourage our children. They see us how we deal with success. They see us how we deal with failures. They see us how we deal with fear. And they're like sponges. And so we are the first examples that they will see before they go out. The other thing I want to say is that you must also be careful about who influences your child. A few months ago, I had a very interesting 12-year-old. And when the father called me, he said, Dr. Egbami. I said, what's the problem, sir? He said, my son wants to be like Bobrisky. And I said, sir, so what have you done? He said, I have beaten. I said, sir, that's not the solution. Bring that child in. Let's even see where his mind is at. Let's see where his thoughts are. And let's have him guided and influenced by someone who we can all look at. And you know, when that child sat in front of me, and I'm like, so I hear you like Bobrisky. He said, yes. Tell me why you like Bobrisky. He said, Bobrisky is popular. Is it not true? Before you came here, how many of you knew me? How many of you knew Dr. Akinola? He said, Bobrisky is rich. True. But will this thing stand the test of time? We also need to put, you know, people of value and character around our children so that they can look at them as people of influence. Thank you.
Just 2 quick points. Each child has a different pattern of developmental evolution. There are some who are very quick, they are early starters. There are some that are late starters. As a child, I was very restless. Maybe they will call it an attention, whatever they call it, all kinds of names. I could never sit still. I could never focus and concentrate. And of course, you know, the result came out in you have all those A's that already have one leg broken. When you have your A and the right leg is broken, you know, it's always bleeding. Because, you know, in primary school in those days, they will write the blue and the red. And some teacher said, you can never do well. You are useless. You are this and that. But I got back home. What Dr. Bunji just said, and my father would have nothing of that. No. You are my son. There's no way you can be useless. You know whose son you are? Forget it. But my teacher said, yeah, that's incidentally, he has full right to his ignorance. Because he doesn't know my son. And I began to think, oh, he doesn't know. That's true. He knows me better than the teacher. Talking about building up your self-esteem. And I believed that that's true. And my father was the smartest person that I ever knew as a child. And I believed him. Incidentally, by the time I suddenly woke up, I started out as the last in the class, by the way. You know, that's no point of shame. No. I started out as the last in the class and ended up as the top in the class. So that evolution is possible. It is feasible. I'm not one of those fathers that will come out and tell their children that I was always first from first. It did not happen. It did not happen. So, and that was one of the things in my whole life as a teacher. I will stand by the weak students, by the problematic students, hold their hand and walk with them. Because at the time when I was going to be kicked out of school for developmental problems, the principal came out, called me from the dorm, and walked with me. And that made all the difference. I mean, this boy that I was on the point of being expelled, by the way. And he came to the hostel, took me out, and then took, you know, the way he dealt with it, he said, you know what? you have just broken a new record. And I'm like, what record? He said, I used to think my son was the stupidest man in the whole world. But I just discovered that you are better than him. You are a lot more stupid. Now, I had a difficulty. Now he was comparing me with his son. And this is an Oyibo man. He was a Canadian. So I felt very well, very good. But the other side, he said I was more stupid than his son. So which one do you celebrate? Which one do you reject? He was giving me two things at the same time. Where he wanted me to be and where he did not want me to be. He loved his son, but he didn't, and then he began to show me, look here, what you are doing. Some people already said this is what you would do. So your expulsion paper is already signed, but not yet delivered. If you did what they said you would do, you will get your letter. But if you did disappoint them, and so, then I refused to comply with their prediction. And guess what? I have multiplied that over an entire 40-something year career with other students to let them know, no, you are not useless. But the second point is this. Sometimes we are judging in the primary school, sometimes secondary school, at the early stages, everybody is being judged with the same criteria. One size fits all. You can judge a fish by the ability to climb a tree, and that fish will be a failure. But put that fish in the water, and then you begin to see wonders. So children that are not adapted to one can be adapted to something else. And that's why we need to find where, again, observation. Study your child, find where they are strongest, and just like he said, praise them, encourage them, build them up in their point of strength. It will raise them up in their point of weakness. Thank you.
Thank you very much. We'll proceed to number 7. But before we take number 7, I want to thank our panelists for all of the points that they have tackled, all the questions that they have tackled. But then something basically resonates with me. The question from number 6 about the performance of a child. There was something I noticed of recent. I was telling my wife about it, that way back when we were in primary school, we had the style of assessment where you have positions: first position, second, third, fourth position. But then I discovered that of recent, they are gradually changing that pattern. So they just put pass, they just say distinction, good, excellence, and they're changing that pattern. And I discovered that style then sort of gingered us. We had that competitive spirit, like, I want to do better, I want to break the record. And what I discovered from this new style is that if we're not very careful, we are helping our children not to understand that failing is a part of life. You cannot win all the time. Because if you continue to pamper and help through the process, when the child gets to a particular level in life, and that just dovetails into our conversation around depression, and then the child is used to winning and winning, yes, good job, well done. And then all of a sudden, it happens. How do you expect such a child to feel? I read a book where a billionaire said that my father compensates us for failing. I'm like, okay, that's weird. He said, no, my father would say, no, let failure, let it excite you. Because guess what? It doesn't get worse than failure. When you fail, there is nothing after that. You only get to win afterwards. So, keep failing, but fail forward. All right? So I think that we also need to let our kids start understanding the fact that there are two sides to life. You cannot win all the time. All right, there are times that things will go the other way, but then how to bounce back is what really matters. Thank you. All right, can we have number 7?
Okay, so my question is just very quick. I would also just commend the moderator for that last part. That thing has really helped me. I have learned to realize that failure also is a part of life. My question, I had saved it from when Dr. Bonjubola was speaking, and that's the part where she was talking about carrying children along, carrying your words along. I'm a typical African man, and we're all typical Africans. How do you match up experience with zealousness? Why I'm asking that is because I know for a fact that zeal cannot beat experience. So how do I match up zealousness with experience? I know this thing about this place, and I'm trying to ensure that my child does not go there. I use the example of a school. I know what this school, this university is about, and I don't want my child to go to that university. And then the child is insisting that that's the university he or she wants to go. How am I supposed to match up this child's zealousness or this activity? How do I match it up with experience? Because sometimes you may be forced to go the hard way. So how do I match this up? And I'm asking because I have twin boys growing up. So I just need to know what to do when it happens.
All right, thank you very much. So I'm a young parent, and I know that there are older parents here. But I know the place of having conversations with our children now for information as against when we were growing up. We didn't have a lot of, information given to us. There was something that my dad used to do, and I usually encourage parents to do it. Just ask your children random questions. One day, my father looked at my youngest brother then, and he said, "Tell me something I don't know about you." You know what my brother told him? My brother said, "Dad, I pretend a lot." My father said that his brain wanted to explode. So what exactly is the truth? What I've realized, at least with my own children, and I use my own children as, is that I don't need to beat all the time. I have a kid, we call it Dr. Pepe. But most times when I want to use it, we don't know where it is. But I know that having genuine heart-to-heart conversations with my children helps. There are days when, we're driving home years ago, and this is not now. And children will say, "Mom, let's stop at this supermarket." And one day, I just said, "No, we're not stopping." And they were like, "Why?" And I was like, "Because I don't have money." And they said, "Mom, we understand." Not many children in this day and age, they'll say, "No." Some will throw tantrums. They'll say, "Lie, you've always done it. Why are you not doing it now?" There will always be a place for balance. When Prof was speaking, and he was speaking about that university, undergraduate, it was as if he was telling a story that I knew. There was also a child that I knew who was far away in America, whose parents thought he had graduated. In fact, they went for the graduation. They had graduation pictures for a child that did not graduate. And so it was eventually when they had to travel to go and do something that this child also attempted suicide. He didn't die. He made it. And so when I hear things like, "I paid the school fees, but I can't see the results," no, it can't happen. There are certain things that we shouldn't consent to. And by saying you shouldn't consent to it, it also probably means that you may need to insist that your children have, for instance, their first degrees here. Because if you're sending a child abroad, many people always want to send their children abroad without realizing that the culture will influence them. There's no how you send a child to America and America will not influence that child. Of course, you've laid down the foundation and you are hoping that by God, all the things that I taught this child will not forget. But children are different, influences are strong, and when children get to the other side, where they are alone, they are faced with a lot of, decisions to make. So my own at the end of the day is, I'm not saying let your children be the ones who dictate. There's this saying that it is he who pays the piper that would dictate the tune. But of course, your children also want to see you as a partner. Not all the time, this is what daddy says. more often than not, when you get to that point, family history, and you're saying, so tell me about your relationship with your dad. They say there's none. It's just the provider. It just brings money, and that's the end. I remember sitting with a child and the father one day, and the father looked at the child and said, after everything I've done for you, you know what the child told the father? You didn't do it for me. You did it for yourself. And so you don't want a situation where you'd have worked so hard, struggled so hard, done everything, not have a relationship with that child, not be able to, you must know your children. Every time I remember Frank Olize, I always remember when Frank Olize would come at 9 o'clock on Sunday and say, it is 9 o'clock, it's time for Newsline. Where are your children? We must know our children. We must know their love languages. We must be able to balance things with them, but we must also let them know at certain times of your life, I will be your coach. At certain times, I will be your friend. At certain times, I will be your parent. However, when the decisions are supposed to be tough, then we will make and take tough decisions about certain things. They may not always agree. You see, there was a day I remember my daughter said, I said, so let's go swimming. She said, Mom, but you are the one who wants me to swim. I don't like swimming. I said, what are you saying? I said, do you know why we're doing this thing? She said, no. You may not know now, but you will understand later. And I told her, I said, you see what an adult sees sitting down. A child, even if he climbs to the Eiffel Tower, will not see it. Trust that I will take the best decisions for you. I will not put you in harm's way. I will listen to you when you say certain things. But at the end of the day, by the grace of God, we will help our children to make the best decisions. So I think that at the end of the day, it's about creating balance. It's about making that child feel seen. I saw a child a few weeks ago, and it broke my heart when that child sat down there and was telling the parents that for the past 30-something years of my life, you've been running the show. I was like, imagine. You've been running the show, and all of a sudden now I want to take care of my own life. No, that doesn't speak to a child who feels like all that the parents have done has been, celebrated or accepted. So again, I said that earlier on, we must pray for kind children. We must raise kind children. But most importantly, we must also be kind parents, because our children, again, we are the first role models that our children will see. Thank you.
Thank you very much, Doc. The final question, number 8.
Good afternoon, all. My name is Balogun Tosin. Permit me to stand on an existing protocol. While Dr. Ajiro Tutu was speaking earlier, he made mention of a certain scenario of someone probably fed up with life or something, then jumped into the lagoon from the third mainland bridge. And according to him, he said people will automatically attribute it to Owaye, in quote. For those that don't understand Yoruba, that is it is not ordinary, or we say metaphysical stuff. So now the question is there any connection or correlation between culture, spirituality, and depression and suicide? Is there any connection? Or do we just assume or conclude that the Owaye, in quotes, is a myth as regards suicide and depression? For instance, I want to cite an example as well. Someone who has lived in the state for about 2 or 3 years, and suddenly he had a voice, go to Nigeria, go to Nigeria. Then he lands in Nigeria. Then 2 days after, he woke up and said, where am I? How come? I was in the States about 2 days or 3 days ago. Then, maybe probably out of documentation issue, he could not go back. Of course, certainly he's going to fall into depression, and such fellow might even think of suicide. So what do we attribute this to? Do we say it's spiritual, or probably it's one of the symptoms of causes of depression and suicide? So please kindly address this.
Okay, thank you very much. Well, the example I gave was about a man that committed suicide at the Third Mainland Bridge. Yes, there'll be pointers. If you look at the signs and symptoms of depression I talked about, you have the behavioral, you have the cognitive, you have the physical, and you also have the fourth one, behavioral, physical, emotional, and cognitive. Do you understand? we are scientists. Do you understand? And like somebody would say, oh, you know, culturally, somebody placed a curse on that person, and that is why he or she had a breakdown. And that person is brought to my emergency at Yaba in a very bad state, probably hallucinating, aggressive, disheveled and all that. And he comes in. The doctor sees the person is placed on medications, is admitted. Within a week or two, most of the symptoms start subsiding. Probably by third week, I'm sitting with that individual, and we are talking about the issue that happened and all that. And I tell him, could you remember that when you were brought to this hospital, I have the presenting complaints there. You were aggressive, you were shouting, you stripped yourself naked. I said, how can I do that? Hey, me, I can't do that too. And blah, 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 blah. That's not me. But even the family members will still believe it's cultural, or somebody plays the. I will tell them, while we do the treatment, you can go about and pray. Go about and pray. Some will go to the traditionalists for prayers, but we will treat. Also, medically, orthodoxically, we treat. And we tell them, this is the consequence. After we've treated this patient has been discharged, we still place these patients on medications. We are Christians, we are Muslims, we believe in prayers, the religion aspect. And culturally, do you understand? I don't believe that anybody can place a curse on another person, that person becomes mentally down or break down. Because science has proven over time, I've seen people that Dr. Kuna will place on medications and the patients will get well. And the patient, after a while, goes off medications, the patient relapses. And we bring the patient back for treatment, and after complying with the patient gets well and stays on the maintenance dosage, and the patient does. So we cannot take our cultural beliefs. I have regard for that. But in issues where we believe that, oh, somebody is responsible for this person's behavior or this person's action or this person's mental illness, well, that is open to their belief. And you respect people for their beliefs. Yes, we can pray. We have the Catholic Church, they come to pray for our patients. We have the Muslim community that also pray. But we see the role Orthodox treatment take or make in terms of making our patients get well with compliance with medication and treatment. So, then the traditional healers too. Some of them over time, they come to buy medications there and they grind. I'm telling you. They come to buy the medications in the hospital here and they grind them and they give them with water. And the patients get well. And you pay more. So, but you won't take people's cultural beliefs away from them. But the most scientific method of treatment, which research has proven, we've seen results, is the best. Thank you. Additional.
So in addition to what Doctor has said, if I hear you correctly, Doc, what you just said is cause and all that cannot cause mental illness. But our culture, your patients believe, the culture, where they live and all that affects that management plan. So if you don't put it into consideration, your patients won't get well. It's like I'm giving my patient the medication that you must sleep throughout the night. That's why you're going to get well faster. But he's a Muslim, he has to wake up. There's a prayer they do at 3 a.m. He has to wake up to pray that prayer. Do you think that patient will get well on time? So once I see a Muslim, I ask, what are all these things? I know you pray at 3 a.m. Right now, don't pray. Pray before you sleep, or you pray when you wake up, because you need to sleep for the next 1 week or 2 weeks. So we need to talk about these things. And I know Christians too. They must wake up at 12 a.m. to pray. They say they are doing dark things at 2 a.m. 3 a.m. is the best time to pray. You need to put all these things. And they'll say they are going to fast. That medication will not work. you are starving the brain. Then so, okay, you have to fast, that's okay. If you fast till 12, that's fine. Because you must not starve your brain. So eat and take your medication. Then you take the next one, maybe 8 hours later. You have to discuss these things. If you don't, they will sit in front of you and tell you, yes, doctor, I have heard. And they will go. They won't do anything. And they will bring them back in a worse state. So our culture, our belief, and prayer is good. Even scientifically, we've seen that when people pray, they tend to get better faster. So you can't divorce your patient's belief from the treatment you want to give. Thank you.
Thank you very much. Can we appreciate our panelists one more time, please? Thank you very much. Please, before we move from the stage, yes, we are going to take a picture, but we have a gift for the 8 individuals that have asked questions this afternoon. Yes. We're going to choose. All right, so can we have 1 and 2 come up? Can we have 1 and 2 come up? Number 1 and number 2. Okay, let's have number 2 come up for your gift. He's right here. He's on standby. Number 3, number 4, number 3, number 4.
so I will not be queried. Dr. Abiri, Mrs. Akinola, Dr. Ajirotutu, God bless you. I appreciate you. May the Lord be with you. And my big brother, my big egbon, Professor Makinde is our Oga Patapata, our board. God bless you, sir. I pray that as you go home, the Lord go with you. Every issue that look difficult